Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with David Relman, a professor of medicine and microbiology at Stanford University. He's concerned about well-intentioned laboratory research that creates pathogens with pandemic potential. And he even wonders if the world is dealing with the consequences of such research today. Let's listen. David Relman, thank you so much for joining me today. You have written with concern about laboratories that create pathogens with pandemic potential, deliberately in order to study those pathogens with the idea that it might help society be more ready. You've written with concern because you're worried about the danger those pathogens could actually cause pandemics. Now, here we are in the middle of a pandemic. And my first question is, how relevant is your concern today?
I think it is relevant. And just to be clear, I think in the setting of this pandemic, the question about how did the pandemic arise? What's the origin? Is an important question. And I would suggest that we don't have a clear answer. When I think about the possibilities, there are two major possibilities. One, that this virus arose out of a natural reservoir like a bat and perhaps entered an intermediate reservoir before infecting humans or went straight to humans. And all of that could have happened through entirely natural means, through what we call a natural spillover. The second possibility is that this virus spent some time in a laboratory first before getting into a human and before it infected a human. And I think that both of those possibilities are plausible.
Is it possible that we'll have an answer on that? Are there ways to find out?
I do think there are ways to find out. I don't think we have fully explored them as yet. I think that the results of those efforts are likely to be greater clarity on these two possibilities. I'm not sure, though, that we'll get to a definite, conclusive answer.
So I don't hear you saying, but I want to be completely sure that you think it is a serious possibility that somebody deliberately created SARS-CoV-2 in order to release it and cause a pandemic.
Correct. And maybe just let me back up. As to the larger question, what do I think about how this pandemic began? I would say, knowing nothing else, first of all, nobody can be sure, but I would say that the origin is most likely to be natural. Why? Because nearly all pandemics and outbreaks with zoonotic agents have in fact been caused by natural spillovers. So I would probably just go with the odds here. But having said that, I think it's still plausible to consider that this virus came out of a laboratory and got into humans. And as I said, there are several scenarios that involve a laboratory. One is the natural virus was collected, grown unknowingly, and then accidentally infected somebody in the lab or was discarded without ever knowing that the virus was in hand and had been leaked. Second, the virus could have been known about in the laboratory, and people could have been studying it for very good reasons, maybe even manipulating its genome. But again, it accidentally leaked out of the laboratory through a number of possible mechanisms. Finally, this issue that you've raised about whether it could have been deliberately released from the laboratory, I think is much, much less likely. Why? Because when you look at the consequences of the pandemic, it's clear that everybody has suffered. And everybody, without exception, to include those that could have been working in a laboratory from which this virus could have escaped. So it just seems much less plausible that it was not only deliberately manipulated, but also deliberately released. The other two possibilities seem quite reasonable to me, the natural and the laboratory accident.
So what are the rules that apply in this situation? What is the global approach to studying potentially very dangerous viruses or even manipulating very dangerous viruses?
It's a really good question. I don't think that we have universal or standard rules. I think we have some informal norms, perhaps, and those norms would say, thou shalt not undertake work which you fully anticipate leading to the creation of a potentially pandemic virus that didn't exist before. You shouldn't do that without asking others for their advice and oversight. But that's simply a norm, and I'm not sure that everyone has thought this through or fully accepts that. And in particular, I think there could be work that scientists are, again, understandably undertaking without fully thinking through where it might lead and what it is that they might be creating along the way.
So you have publicly funded research, privately funded research, and the tools to do this kind of research are not so hard to come by, are they?
The latter statement's correct. Yeah, this work is increasingly easy and easier for more people to undertake than it has been in the past. And today, it's not that anybody could do this work. And by this work, I mean create new viruses or engineer existing viruses to take on new properties. It's not that everybody can do that or anybody, but a growing number. And, we might argue about what range, what ballpark number of scientists around the world can do this sort of thing, but it's certainly many, many dozens in each country, maybe even hundreds in some countries. And what that means is that scientists around the world have the ability to create new viruses that have properties that current naturally occurring viruses don't have, including greater degrees of pathogenicity, which means the ability to cause disease, as well as properties of increased transmissibility.
So typically when we think of the scientific process, we think about scientists sharing what they're doing so that other scientists can build on that. You've written that process here may not be so great, that if people are working on these important issues and talking all about them, they may actually be giving a recipe for people to create a serious pathogen. Are there any policies or norms about what people should publish about research in this area?
There are some policies here in the United States, and there are some norms as well. And I think all of this is sort of rooted in the issue around why scientists do the work they do. I mean, I sit at a university, and as do you, and much of what we think about and talk about is work that's undertaken in universities, much of which is funded by public agencies. So here in the United States, for example, if you want money from the US government, then you must follow certain guidance and policy and procedures that do create some constraints around this kind of work. But if some of our colleagues or would-be peers are operating in the commercial or private sector and they don't require public US government money, then the rules around their work are a bit more ill-defined and perhaps non-existent even. And then when you move elsewhere in the world, we could be talking about very different social and cultural contexts in which scientists think about why they're doing their work and for whom, and the kinds of motivations that drive them. Those motivations include not just the quest for, deeper knowledge about the world around us or about helping humanity. They also include interests in fame and publicity, interests in financial remuneration, and even power. And I think some of my colleagues would cringe to hear this said, but in fact, if we're honest, all of those motivations are at play here in the United States as well as elsewhere. And you have to be considering those motivations when you think about how exactly people do work and the choices they make about what experiments to do at the beginning of the day.
It strikes me that without really clear rules or an approach to this issue of, potentially creating pandemic pathogens, you have two problems. You could have an actual problem, and you could also have the suspicion of an actual problem. Right. And the very fact that you're not sure about where the SARS-CoV-2 virus originated, makes you wonder, even in the absence of definitive evidence, because maybe there weren't the clear policies that you would want and a way to check that they've been followed.
That's right. And I want to be clear. I don't myself believe that it's likely someone not only deliberately created this virus, but decided to deliberately release it. The reason I think that just is not plausible is because the consequences have been so grave for everybody on this planet, to include whomever might have been involved in its creation, if in fact that did take place. So I would discount that particular scenario. But the idea that somebody may have been genuinely interested and well motivated to understand this virus, and in so doing decided to manipulate related viruses in the lab and perhaps didn't tell everybody, could have been all undertaken for very understandable reasons, but still nonetheless been risky and could have led to an accident.
So that's a big one to take in, and certainly very, very concerning. And the fact that we don't necessarily have a system that could very clearly assure us that that didn't happen, that alone is concerning. What would that kind of system involve? Like if you were going to pull all the scientists in, let's just assume on a Zoom or a video call these days, and everybody was going to come to agreement, what kind of system would you want that would both protect against the reality of a problem like this and the potential perception?
I think there are a few components. The first component of a new approach would be to have an honest and widely distributed discussion about what it is that we are most concerned about. Are there things, for example, that we agree we should not do or make? I personally believe that there are places like that, unusual, perhaps, or rare, but nonetheless experiments that we ought not to undertake. That's not to say that they might not be motivated by good questions. And so I would distinguish an important question from the approaches and the options that we have in addressing them. So that's the first component. The second component would then have to be, how do we provide the boundaries? How do we create boundaries and then maybe enforce them? And there are two basic approaches. There's the top-down approach, where perhaps nations impose law or regulation, the violation of which would prompt consequences. But another kind of top-down approach is guidelines or guidance, which has fewer consequences for violation, but a lot more flexibility and agility for modification and engagement. And then you've got the bottom-up approach, which would then rely on many, many scientists who are interested in this sort of work to agree upon certain norms and agree that they would speak up if they see norms being violated. Now, how do you do that latter thing? I think you need proper incentives. You need to inspire people as to the importance and then encourage them through positive incentives for speaking and having open conversations with their colleagues down the hall, or anybody for whom they think perhaps there's been, sort of questionable work undertaken.
I guess one question is, how do you engage in a serious conversation? And I'm asking this in all sincerity about something that is just almost possibly hard to contemplate. Just the very fact that you're open to the idea that a lab could have had a role in this pandemic that we're in now. It's a pretty shocking concept. And what you're talking about is really confronting people with the idea that something they're doing in all good faith, with the right goals of science, could go horribly, horribly awry. I'm imagining people don't want to talk about stuff like that. How do you get to that point?
Yeah, the way I would start is by, first of all, acknowledging that all humans are fallible. All scientists make mistakes. And I would start with mistakes that I think I may have made, perhaps not with anything like this consequence, but mistakes that I know my peers and colleagues have, and they've been revealed by investigative efforts, by journalists who, for example, have been interested in how often have lab leaks of pathogens taken place. Some of the listeners may not be aware that work by people like Alison Young from USA Today several years ago showed that there are literally thousands of accidents that take place in the United States, many of which are not publicized, none of which were undertaken with malice or malintent. They were honest mistakes made by very good labs, including our very own CDC, including all of our, most, well-regulated laboratories in this country. And I think for anybody to begin a conversation about perhaps there was a mistake done elsewhere, you need to begin with some humility and some honesty about the fact that everybody makes mistakes, unfortunately. And until we acknowledge that and begin to understand how and why and what are the means of minimizing those mistakes, we can't really point fingers and suggest that anybody else is more fallible or more, responsible than anyone else.
Well, certainly discussion about the origin of SARS-CoV-2 is, in and of itself, is a conversation starter, for something like this. And I certainly will be watching much more closely after talking to you about how this conversation goes and whether we're able to take from kind of out of the shadows the potential risks that are there in order to avoid very serious catastrophe in the future.
Yeah, I genuinely hope that we can have an honest, open discussion. It's going to have to be brokered properly. The possibility of recriminations has got to be minimized. It's all about the proper setting, and it's all about trying to establish relationships where one's not pointing fingers and asking for, penalties, but rather openness for the sake of ensuring better safety going forward.
Dr. Relman, thank you so much for joining me.
My pleasure.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.